Okay, well, I think I'm going to go ahead and jump in. This presentation is going to be a little bit different than last month's because there's a lot of content again to deliver. So while I've hoped to have some time for questions and answers and interactivity, just know that, the first part of this is kind of content delivery, but I've tried to make it very applied. So I hope that with some examples and things like that, it'll make it more interesting. Also, I just want to start out with everybody's coming at this probably with different backgrounds and experience. And so as a speaker trying to come up with something that's useful, I try to really pick something that was not at the very beginning level, but a little bit above that in terms of like a literature review, for example, like assuming that, you've maybe had a little experience in med school or residency, but some of you may have much more experience. So I'm going to apologize in advance, but if you're like me, it doesn't hurt to learn things over again, because every time you see a different approach, it might remind you of something that's helpful. So that was kind of my orientation with this talk. And then, as I was saying before, many of you were able to get on. I realized why I'm doing another lecture for this instead of being able to find a guest speaker, because this was a topic that was requested, but boy, is this a challenging topic to cover. And so as I got into trying to figure out how to sort and wean and figure out what's useful, I was like, oh boy. So again, you may feel, hopefully there's practical things, but this is just, I would say, like the beginner, 101, how to get started. And then there's lots and lots of resources. And hopefully with working with mentors, or if you have your particular projects that you want to discuss, feel free to, albeit as STFM, I'm always happy to just provide research consultation, just chat with you a little bit about if you've got a particular project. So feel free to email me as well about any thoughts, or if you want to have some in-person time to discuss kind of study design. So with that, I'm going to go ahead and jump in. One second, make sure. Okay, so really what we're going to be talking about today is three things. The overall frame is, how do you come up with a good research question? What means like a question is good and answerable and interesting and all those different things. And I'm going to spend a little bit more time on, kind of lit review, because that's really essential, as we'll get into. And then also then thinking about different study designs, some of their limitations and some of their approaches. So with that, let's just dive in. And this framework comes from Family Medicine and Community Health, the journal. In 2019, they did a really nice special issue aimed at trying to increase people's understanding of how to do research in family medicine. So I think we'll send the PowerPoint out afterwards, and you have time. It's pretty quick reads. There's usually 1 to 2 page articles on all these different aspects of it. But with this framework, I like it because it's the 20,000 foot view. So when you're trying to take the scholarly mindset that we've been talking about all along in this series, it's really important in terms of developing research questions to follow these steps. So first is just to have an awareness of what's going on, right? Don't, in your different settings, when you're in your clinic, when you are teaching, different types of learners, just observe and have this awareness of what's going on, and start to ask yourself, what are you seeing? Is there any kind of problems that you're noticing? Is there something that's positive, a more strength-based approach, right? Are certain groups really resilient, or something that you thought would be a problem isn't, right? So this is this inquisitiveness piece that's so important as you're thinking about taking a scholarly or research approach to what you're doing. The next piece is this framework of, and the framework is reflecting. So, you only want to do projects that really matter, right? All of us have limited time. And so is this actually going to be something that's important? It's going to change the way that I do something if I answer my question. The best questions are the ones that you actually really care about. Then we'll get into the lit review. It could be that you're really curious about something, it's so important, but somebody else has figured out the answer to that question. So then you want to change your frame a little bit to come up with a different way of looking at it. And then lastly, we'll get into defining your question and coming up with a hypothesis, which many of us think about, of course, with science, right? Like, what is that step? But all this early work of figuring things out is so important. So now we're going to jump into the lit reviews. And what you're going to get here are more about my tips of doing lit reviews, and a little bit of how to. But the most important thing is to convince you about the why. So I'm going to start out with that. So throughout this, you've heard, this idea of scholarship is having a conversation. That's often used, right? Who do you want to have a conversation with? Who's interested in the same things that I am? And the same example I like to use for lit reviews, and so have others. So when you could think of a literature review also as a conversation, right? And so you see these people, they're all interacting, they're having a conversation, and about what's out there, what do we still need to know? Where are the gaps? And if you don't do a thorough lit review, it's kind of like showing up to that conversation with your own ideas and really ignoring all that context, which we all know is pretty socially awkward and not much fun either for you if you have that self-awareness in the group. So that's another just little visual as to why the lit review is so important. So what are you doing in a lit review? Well, this is going to look really familiar from the talk I did before, because it's the same thing that you need to do for when you actually write up your study that we're going to talk about. So you're again trying to get a sense of what's known about your topic and who do we know this in? So that's what I mean by in what context, right? Which populations has it been studied with? Which kind of groups? What subgroups, all those sorts of things. Has it been in the US? Has it been in residency programs? Has it been in primary care, right? So just that overall landscape of what's there. What's still out there that we don't know? What's the gap? So by the time you're done with your lit review, you should have a sense of where there's some opportunities to do some research. And then, of course, how does your study address the gap and why is that important? So again, this is this whole concept that's becoming popular. So you see the little button down there, design for dissemination, which is that we need to be thinking at the very beginning, how am I going to get this out in, scholarship, publication, and presentation. So you really want to have a framework that helps you get this idea. What's there? What's missing? How am I adding to it? Okay, so I decided to put myself to the test. So this is something in clinic, I decided, okay, let me follow the steps here. And I wanted to walk you through it a little bit practically of how that might look like. So I had one of those days, I think we all probably have had those, where I was running a little bit late. I had a bunch of meetings and then first patient, 1 o'clock's already sitting in the room, showed up, 40 minutes early. And I'm like, oh goodness. And then had a lot that we had to get done. So I was running late all day. And what I observed there was, oh, wow, when I would walk in, apologizing, of course, almost all my patients were taking the time, to sit on their phones, right? That's what they were doing and spending their time before I went in. So I thought that was interesting. Of course, that's been happening in the past, but I really just noticed it that day. And then that made me wonder, well, they've set aside this time to be in a clinic, is there a way that we could be using their phones that they have? And, a lot of us are talking about goals and sort of motivational interviewing and putting that in our visits. So could we do that to get some goals around physical activity? So then the next step, right, reflecting about it, of course, I know activity is good for chronic diseases like diabetes and depression, which a lot of my patients have. And I'm really sometimes getting frustrated with those chronic diseases because I feel like we're being more reactive to those as opposed to proactive or preventive, as a general frame. So, that's just walking you through how you go through those questions. And then, of course, you get to the lit review, like what's been done before, which is where we'll move on. Okay, so these things might be not the standard way, but I'm going to show you shortcuts of how to understand if there's gaps, right? So that's a little different, I think, than can be out there. But the first thing I like to do from an efficiency when I'm doing a lit review is really see, has somebody else done the work in some ways for me by doing a good quality systematic review? And more recent, so in the past 5 years, right? So sometimes for different reasons, and later you're going to get into individual articles, but at first it's really helpful to just figure out who else has done this work. And then we're going to go through, once you get that systematic review, you want to kind of look at how they did it. Look at the inclusion criteria, how they did the search, and then how you use that to add to your knowledge. So bringing together our topic, right? I just quickly went into Google Scholar and decided I better go ahead and see what's out there about mobile phone use, right? And then my patients in particular, we practice in a particular underserved setting here in New Mexico. So I wanted to know, what does the research say about that? And voila, here is a systematic literature review. It was done, they focused on the US, seems pretty relevant. Boy, they did a lot of work, 16,270 articles on the original screen, way beyond what I would ever be able to do. And they narrowed it down though to 16. So that's interesting. So, I'm kind of giving you my conversation with myself as I come across this. But what did they find? So, yep, they're saying it's a promising area for public health and health education. Cool. That's what I was thinking. We need some more research using mobile phones and tablets. Well, great. My patients were using their mobile phones. So that's looking good for a study. And then their actual findings that it has the ability to increase prevention and health education in the underserved communities, and that they need more research. So I'm feeling pretty good here, right? I found something pretty recent. It's saying that there's a gap, and they've done some of the work. And I could go into more details, looking at the studies, but I'm not going to do that at this point. I'm now going to just jump right into how did they do that? Their systematic review. So, I'm seeing that for inclusion criterion, that they focused on specific populations, priority populations, which can be another term for underserved populations. And they were really looking at technology use or health use. I want to make sure I know what health means, if you're coming in new to that. So I might do a quick Google, like, okay, what's the definition of health if I didn't know that already? And they're really looking at public health, health education, and health behaviors. So that raises the question in my mind, well, would clinics be considered part of public health, health education, or health behaviors, or, not? So I'm already starting to go, what else do I need to add to this study? Okay, well, the exclusion criteria are good to look at. And, they focus on the US, they looked at underserved. They wanted to really look at intervention. So that was the important thing. Sometimes in your study design, you're looking at more feasibility. Do people have mobile phones in my clinic? Before you go ahead and do that kind of study, you need to know that, really important. Or are people even interested in a mobile health intervention before you go out and do all the work of implementing a study? But this particular review didn't look into those aspects. They were just looking directly at the outcome. So that's already starting to give me some ideas of some of the work that I might need to do if I want to actually do an intervention in my clinic. I want to make sure it's feasible. Okay, next thing, each systematic review includes their search strategies, because that's what makes them systematic. The goal is that you could jump in and put those same terms in, the same databases, the way it's described, and spit out the same result. So that can be really helpful in terms of understanding what terms you could search on if you want to replicate what they do. So, here I'm looking at health, and I'm just going, oh, well, health, mobile phones, those are all terms that might be out there in terms of searches, right? So that gives me some ideas. I only did a short version of it. They had, because that's how much fit on the slide, but they had another 8 or 9 of terms that they used. But this is how you might use a search strategy from a systematic review to go forward. Okay, so now you finally get to the point where you might do what many of us probably started with before doing the systematic review, which is going to these different databases and starting your lit review. So, the databases, I think we're all probably familiar with. PubMed. Google Scholar is pretty awesome. Once that started to come out as a tool, it's just so accessible. It goes beyond the journal articles. You're going to get dissertations, book chapters. It's not just focused on the medical piece. So that's awesome to be able to expand your understanding. And then this Eric, which I don't know if this group is familiar with, but Eric really is a a similar database of education literature specifically. So if you're doing an educational intervention, often combining, the three of these will get you the broadest search. And I love it because it does have things like AAMC reports, for example, indexed in ERIC. Other ways, just real quick with lit research searches, is that, when you're putting those terms in, you want to use what are called Boolean operators, fancy word, but they basically mean include ors and ands and nots, things like that. So in our example here, right, so I learned there's mHealth or mobile health is two terms that are the same thing. You put them in. For Google, you would put them in with parentheses and an or. So you do have to take a moment to learn how to do that for the different engines. With PubMed, it's a little bit different. You just send it to it with an or and and. And then I'm interested in physical activity. So I would take all these things that I'm interested and their physical activity. You can put some limits in, right? So I only want articles in English. In general, for scholarly reviews, people tend to go with the last 10 years, is a good frame, particularly when people are going to review your eventual articles. They like to see that your references are up to date. And so 10 years is kind of a talked about standard. I've heard it's not really in writing, but that's what I've heard over time for sure. Okay, so voila, do that. And again, now I'm getting a little bit more focused because coming back to those things that I was confused about, has this actually been linked to mobile health to physical activity? I'm getting a little bit more narrow in at that concept because that was my question of where I wanted to make a difference. And I'd pop up with a different systematic review again. So I've gone back now and I'm like, oh, and this again is giving me some optimism, right? There's some increases in physical activity from these interventions. They're actually maintained long-term. So somebody who's thinking about does this matter? Yeah, cool. There's a sustained effect potentially. There's some encouragement for doing this in at-risk or sick populations, and we need some more studies. So again, just this is showing you how you might use this systematic review trail as a way to start to say, my research idea really matters. Okay, a couple more tips then. So after this, another step to do is to just scan the abstracts from the articles who cited your systematic review that's closest to your question to get a sense of that conversation again. The other thing I like to do, which I feel like perhaps isn't talked about enough, is that if somebody's actually getting funding to do a pretty rigorous study in an area, they often will publish their protocol before they do the study. And those are amazing because they usually have a really good literature synthesis as well as part of the protocol, because that's how they got their grant funding. And you can also get a sense of how they're designing the studies too. Not that you want to do the exact same thing, but it just starts again that like inquiry process. Oh, somebody else is out there. So for example, here I found, this study in the BMJ Open, they published a protocol and they developed basically an app that's interactive that can be used in a clinical setting in primary care to increase physical activity for patients with diabetes and depression. So I'm starting, oh, okay, well, this is like the gold standard study, but I wonder if I could do something with a free app instead, right? That's how you start to build on what you're seeing. Could I get it out pretty quickly? Do I want to use that same population? Maybe I want to do somebody a little bit different and do a pilot study. The last tip is to look for particular authors like this, right? So before you get funding, you have to have done a lot of pilot work. So I would actually go to Google Scholar on these people and click on them and see what they've published in the past. And again, getting a body of literature or a stream of how to do it. Okay, so that's just an applied example of maybe a little different than what you've seen before. When I send out the PowerPoints, I'm going to send out two more classic, like how do you get started? How do you organize yourself? How do you do a lit search, just as reminders. But in the interest of time, I thought that was better absorbed in terms of getting those from an actual article that you could follow step by step, and then to show you an example. But the most important thing I really think is early in your career, figuring out how you're going to organize your literature. So you heard about having this particular focal point, or from Dr. Fry last time. And if you can start to maintain a library in that area of what is your area of scholarly focus, that can be really helpful. Many of you may have at your different organizations and institutions access to some of the programs that do this, like EndNote is a popular one, or RefWorks is another one. But I want everyone to know that there is a free way to do this, which is Zotero. And the beauty of Zotero is it was created to be open access. So you can go on YouTube and learn how to use it pretty quickly. The nice thing about Zotero to organize your references, and I know it's a little blurry to see the screenshot there, but what Zotero lets you do is a couple different things. One is you can build it into programs like Google, any of the Google platforms, or Word with extensions. So if you're actually searching the web and something looks interesting, you just click on it and it goes right into your Zotero, which I really recommend. I don't know if you all have done this, but I sometimes find something I'm really interested in and forget to bookmark it, and then it's like impossible to go find it again with my search. So having something like this, instead of developing the discipline to like, oh, I'm just going to throw it in there so I know where it is, that's helpful. You can also attach a copy of the full article into the program as well. There are some size limitations in terms of how often you can do it, but that's nice. And then you can add notes, right? Like, interested in this because blah, 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 so it's just getting that discipline to do it. And then when you actually go to write the paper, of course, having a reference manager that can put the references in the article format that's required by the journal makes life so much easier. So that is important. And now I'm going to move on to the remainder of our time together, talking about research questions and the methods to design them, which really builds on that lit review. These topics have been discussed over and over, so I didn't reinvent the wheel. So when I set up my PowerPoint, you'll see that I tried to put attributions, everywhere, that I borrowed different things that were ideas. I was nothing's word for word. I was synthesizing things in my own way, but do want to give credit to all the people who've gone before in this area. Okay. So a particular way, a litmus test for your research question is this FINER framework that's been around for a long time, actually. But you want to make sure that whatever you're doing is feasible in terms of the types of participants you need to study, that you've got enough expertise to actually follow through on the design. So early in your career, it might be mentors who've done qualitative research or surveys. All along, depending on your skill set, it might be having access to somebody who knows how to analyze data quantitatively or qualitatively, and who can tell you how many patients or people you need, or learners in your study, to be able to answer the question with enough statistical power, for example. Is your design affordable? Are you going to write for some money, or are you trying to do everything kind of for free? And is it manageable for you in scope, right? Is this going to take you years and years and years before you get a product, and that doesn't really fit what you need to be doing in terms of expectations? Or is this something that you can do relatively painlessly and start doing the presentations and publications? So lots of considerations of feasibility on your research question. Interesting, of course, we talked about that a little bit more. You can see that here. Is it novel? That's about finding that gap, and then either saying, yep, this confirms, it's opposite of what's out there, or it's extending them. Ethical, most of what we do needs some sort of IRB or exemption. And then who's it relevant to, right? And that same idea, who do you want to have that conversation to? What kind of journal will you be able to put this out there, or conferences are you going to present? So FINER is a good way to start. Okay, so now we're going to get into the types of research questions. First type of research question is descriptive, right? And you're really trying to say, it answers the question, what happened? And I'm pulling up an example pretty recently. So this group decided to figure out what happened with the pandemic and what kind of roles did med students have in response. So what they did was they designed a descriptive study right at the beginning of the pandemic in April. And they put this out on an online platform where they had a questionnaire, and they did some pilot work to make sure that it was pre-tested in advance. So those questions were good, they were going to get good answers. Sometimes you might do something called cognitive interviewing, where you have someone take your survey or your questions and speak out loud about it, what they're thinking those questions mean. So you can make sure that you're actually measuring what you want in that kind of questionnaire. And you can see then that they were able to describe the roles that students have, and they ended up basically also noting that people who said that their well-being was impacted didn't have these active roles. So again, purely descriptive. They can't say those two things are linked, but that's interesting. Maybe they are in the future for a study. So descriptive studies are often really inexpensive. They're quick, as you can see here. And what they do provide is knowledge about kind of different categories of people, how often they're doing things, frequencies. And it can be really helpful when you've got areas that are relatively unexplored. It's like kind of like your baseline, I think, is finding descriptive studies that are just describing something that's happening. But the challenges with descriptive studies, it sometimes is they're difficult to publish. I think when we think about different levels of evidence, this is kind of like the very, generally considered like the lowest on the hierarchy of evidence. And so some journals just don't want to do something that's purely descriptive. And also because they're kind of really situated in a point in time, you may not get the same result in the future. So that's a part of the reason why descriptive studies are kind of considered lower levels of evidence. And they're not causal, right? So you're just observing it, but you don't exactly know why you're observing it. So that's the next step on it. There's lots of different ways to do descriptive studies. I'm not going to go into the details too much, but surveys, as we saw in that example, case studies, we know that from our clinical literature. We see a patient with something and we describe it and write it up because it's really interesting. Or field observations. And field observations, sometimes, that seems perhaps something that we didn't learn, but to give you an example of like a practical field observation, I had a student who wanted to see if the way different waiting rooms were set up in clinics affected interactions between like the patients and how they flowed through the space. So, he spent his time during his MPH just hanging out in waiting rooms and making observations of the different ways that the flow was impacted by the design. And it was a cool study, managed to get published because that was kind of a novel way. So sometimes just, thinking of what we might be able to do some structured observations in a particular setting is a different way to do a descriptive study. Okay. So I'm going to spend the bulk of our time, though, thinking about interpretive research questions. So that's the contrast of those descriptive research questions, where you're really able to make some kind of claim about impact or effectiveness based on your study. So here's one. I know there's people in this group who are interested in POCUS. Point of care ultrasound is pretty popular right now. And this group decided to see if their curriculum actually made a difference. And what they did, they described their curriculum a little bit, and then they did a knowledge exam at the beginning and the end of 6 months of curriculum delivery. And they also did a test to see how people did after they did a skills lab where they actually did some hands-on practice with it. Okay, so what you can see here, again, interpretive study wise, they're able to say improvement, right? Before and after, the knowledge went up. And in a particular groups, they made this a little bit more interesting by saying, oh, okay, you had to attend at least among people who attended at least 2 of these sessions, they had more knowledge. And then this one part, the skills lab, seemed to do better for getting people to improve versus didactics did not. So, pretty clean study design, a way to kind of build it into probably something that they were thinking of doing additionally. So there's lots of methods, again, that you can use. Now, this is where, you could really get into the weeds, which I'm not going to, but when you're trying to figure out what works and how do things work, you might use, again, surveys, and your surveys could generally, I suggest if there's surveys that you can build upon where the questions are already out there and somebody did all that work of validating in the past, that's the best. But you can write your questions as either close-ended or open-ended, if you're trying to get a little bit more of the why is a good reason to get why did this work, what did you learn, right? Like sometimes you might not be able to think of the whole universe of close-ended responses, and then having those open-ended responses is a way to get at that. You might do qualitative. You might talk to people either individually or groups about their experience and how that was different than the past. So that's another approach to kind of thinking about these pre-post interpretive designs. And then your outcomes, the last piece, right? It sometimes getting something that's actually objective, like what we saw in this study, that you're able to look at change in something like a knowledge or a particular skill is a third way to think about it generally. Okay, so now we're going to get into some of the fancy research words, and I'm going to apologize, but I tried to break them down. So in case, anybody, I know for me, I will say I was really new to research, right out of like residency. So every time I heard like something like quasi-experimental, I kind of freaked out like mentally, like, that sounds scary. But basically quasi-experimental means one group. That's at the end of the day, how you think about it. And so I'm going to just run through a couple, designs that you could do with one group. So you might come up with a curriculum and give people a post test, right? So sometimes we do that in our evaluations a lot already. We're doing something and then we do a post test. Nice, that's pretty quick. You don't need to think about who's going to show up before the program starts. But there are definitely some disadvantages to this design. So you can't really tell how much change happened because you're just measuring it at one point in time. They might have came in really high with a bunch of knowledge, and whatever you did didn't make a difference. And whatever outcomes you find, you don't actually know that it's related to what you did. Something else might have been going on with that kind of design. The next design that's a little bit more rigorous is to actually do retrospective pretest. So you're still measuring at the end of it, but you're asking people in some questions to think about what their knowledge was like before they came in and got your curriculum or heard your lecture or whatever you're doing. Again, this is another really quick design. The major disadvantage, just like above though, you're not sure that the outcomes are necessarily related to your program. And then in terms of thinking about how much change happened, there's a bit of recall bias, right? Sometimes people just can't remember, how much they knew about it, and you're asking them to go back and estimate. So you have to sort of believe that they are able to do that accurately. Okay, so then the next design after that we've often seen is the idea of doing a pre-test and a post-test. Now, this is getting a little bit more rigorous. The nice thing about this is that there's, like with good statistical methods, that you can do some controlling on what's there in the pre-test. What kind of knowledge did they have in the past? What kind of attitudes might they have? What sort of skills? If you're asking those kinds of questions in the pre-test, then you can actually control for it. But a disadvantage of this design, again, is that people might overestimate what the baseline is. So we know that some people are really confident and they've scored themselves as like, I know, a lot already when they go into something. And so there's not much room to make changes or see a difference, and it might not be accurate. Other people are the other way. They're very humble, and they kind of rate themselves really low, and then you look like you have a miraculous effect because you've given them some content. So just keeping that in mind is a limitation to this design. The other thing is that actually by having those questions and people knowing they're going to be asked them again, you're doing a little bit of an intervention, right? They're kind of like thinking about those perhaps as they go through your curriculum. And so it's artificially kind of enhancing your result. And then lastly, because there's no control group, whatever you're seeing may not actually be related to what you did. So, okay, so that flows into experimental designs, which you can get then much more data, right? So you do the same idea, a pre-test, a post-test, and one group gets your program or your curriculum, and the other group doesn't get it at the same time. The advantage of that then is you can actually look at change, the magnitude of the difference that happened in one group versus the other, and start to say, oh yeah, that's probably due to my program, assuming that these two groups are the same way. But of course, these are a little bit more tricky in terms of design because you have to think about similar groups and how are you going to be able to do one thing to one group and another thing not to that group. Sometimes in curriculum design, what I've seen people do is offer, people the same thing at different points. So you're able to do the pre-test, post-test design. Let's say one group of residents gets it early on in a block and the other group's doing something else, and then you switch them to, but you're still doing the same measurement, and then you're able to actually get close to having a control group in that way. So that's one of the more like creative but standard ways that I've seen people be able to actually build in an experimental design in education. Okay, and this gets at just quick, we're not going to spend a lot of time on this, but how do you make it really rigorous? Well, if you are able to upfront randomly assign to those two different groups, people don't actually know what group they're in. You make sure that what you're doing is the same no matter what, and when you're looking at the outcomes, you actually don't know which group people were in, and you try to make sure people don't drop out. So just fast rules around trying to increase the rigor of that design. Okay, now in educational curriculum, there's a lot of limitations that are known. One thing is it's pretty hard to keep your groups intact. Life happens, people may, if you're doing it over time, right, they show up here and then they're on a rotation and they can't show up. So, that's part of what you have to kind of account for, and why maybe working with a statistician to know what numbers you need to do in case somebody drops out is a good idea. It's pretty hard to keep treatment secret in our educational settings. People are going to talk to each other about what happened. So blinding is pretty hard unless you're doing it like in multiple sites or, something creative like that. I mentioned the pretest itself is actually being an intervention. And then thinking about your outcomes is kind of tricky, right? When are you going to let people assess themselves and you think that's accurate? When do you actually want to do this based on an actual performance measure? So those are some of the considerations in your design. When do you think that the effect will be short-term? When you're interested in it continuing to be sustained? So maybe you measure at a couple different points. So sample size that you've heard already, there's a lot, but you're kind of stuck with sample size. I mean, you have a certain number of learners. So that then influences a bit about how much you're able to say. If you've got a big group, obviously you can draw broader conclusions. And then, what does it really mean to have no intervention in an educational setting, right? That can be tricky. Is it usual care? So one study I did was we had a curriculum and some med students basically agreed to not have a day off and do more of it. That's how we came up with it. And surprisingly, our IRB said that was okay. But, what did that really mean? We wondered about that because it was sort of an add-on, and these students who were agreeing to do that, which may not have been the same as the ones who didn't. Okay, so coming back to Finer again, the other thing I wanted to just spend a little bit of time is focusing on what makes research and your study questions interesting and novel, and how do you up those a bit, because that's really important in order to get to the peer review journal and the good write-up at the end of the day. Oops. Okay, well, that was different. Okay, so this gets into another term, kind of like quasi-experimental, that used to freak me out when I was first learning about research, which is this idea of a conceptual framework. You will find these in the instruction to authors. Studies should have a conceptual framework. And what does that really mean? Well, a conceptual framework is just a picture that you could either either draw out if you're a visual person, or something that you could write about the things that you're studied and why you think that they're connected to each other. So they can either be really simple, like I think I'm going to do, I'm making one up. I'm going to do a curriculum, and I think that first year med students are going to not absorb as much from this curriculum as the third years. And my framework says you need some clinical experience before this makes sense to you, right? So that's some like theory, and that's, the orientation that I'm having, and that leads to a hypothesis, right? Third years will do better, but I still think this curriculum is valuable because, and then you've got some reasons as to why this curriculum is needed and what gap it's filling. So that's all a conceptual framework is. But if you can actually, again, another discipline thing about research, try to write this down before you jump into the study, and also make it about your literature review. What's the literature telling you about these different things that you're studying? Why are you including them? Okay. So back to Finer, how do you increase the interest or novelty of what you're doing? One thing that you did, so to prep for this talk, I actually just skimmed the last 4 articles of the journal Family Medicine to get a sense of the different study designs that people were doing and getting published. And one thing that I've noticed more and more being important is this idea of sustainment of outcomes. It's feeling to me, and I hope this isn't too cavalier, that people are like, oh yeah, you taught people something and it made things a little better. But, is that really important over time? Like, how do you know that that actually had a difference on actual practice, or people carried with them with that in the future? So more and more people are doing post tests or thinking about ways to reach out to their learner group, if you're doing a clinical question, across time, maybe even when people have graduated, to see what the effect is going to be and more sustainable. So I just wanted you to think about that. Of course, that does, from a feasibility perspective, you want to be thinking about that, like, how do I stay in touch with people? Does my program allow me to do outreach to the residents and graduates? Do we have that information? Do we collect it if you're doing it? But it does increase the interest, I think, overall in your study. Okay, another point is understanding in whom something works, right? So this is beyond saying, oh yeah, my program works, who does it work for? And for multiple reasons, you can imagine, right? Maybe there's a particular group that's being excluded from the same advantage as another one, which is a hot topic, of course, now, a particular type of learner that you need to change or tweak and adapt to. The most important thing about an understanding and something works from sort of an ethics and a research is you want to think about this prospectively. So it's really not good to go data mining and backwards and be like, oh, can I get a significant result if I take this group and compare it to that group? So the more that you can have this rationale for a relationship based on the literature, or it's just face value, right? Like something like, oh, people later in their training program should have more skills, and so they should do better. Like that's a very basic association, and why you might subgroup based on that. And again, leads yourself to a hypothesis. Then if you're doing it up front, you can say, this is why I think this group, we should study this group versus that group. So what kinds of subgroups out there, right? You might do demographics, generally, and break people up into different by age, training, I don't know, social status, all sorts of things like that. You might do like empathy studies. Something I like to do a lot of are, if people are coming in, I want to see the effect of what I'm doing on empathy. Maybe it's going to be that people who come in higher or lower in empathy actually see more of an effect. So with empathy, there's lots of studies that show if you come in pretty low and you get a good intervention, you're going to get the greatest gain compared to somebody who's already coming in pretty high, for example. There's some statistical stuff. There's a term called regression to the mean that does, I'm just going to briefly mention, I'm not going to get into the details of it, but generally people who come in really high over time naturally sort of come in lower. It's just harder, and this works out statistically. So you have to think about that a little bit in how you have your subgroups if you're going to do high or low. But I'm going to leave it there. Google it or learn more about it, because I think I had a whole class on it somewhere along the way. But again, with these subgroups, assign them up front, measure things at baseline. Don't go back and try to measure it, and try to limit the number, because if you have too many subgroups, you don't have enough power to actually do that. And you can end up with sort of false findings on the analysis if you're looking at splitting your data in too many different ways. Okay, so another way, and we're almost towards the end, is understanding the why, right? Why did something work or not is another way to increase the novelty of your design. So beyond why it worked, who did it work for? If you can throw in the why, this helps. So again, theory, gets you started. What's known about why certain things work and don't? That's like a very solid lit review in your field. Is it about the delivery? We know that more interactive lectures, unlike this one, work better for people. Or is it another, so just starting to think about those whys is important. I'm going to throw two concepts in here, which are kind of more novel, which are coming from implementation science. So that's a particular field of theory that is just starting to get applied more and more to curriculum and other research. But you might want to think of what you're doing. If you think of a curriculum or your intervention, what are the different pieces of it, right? So we saw in that study, and we'll look at it again in that POCUS, they had two different parts. They had didactic lectures and they had more hands-on or applied, right? So what are the components of it? And the why is there a dose response? Showing up to more lectures, does that actually give you a better outcome at the end if you're doing a more longitudinal curriculum? Can I track that and can I measure it? What are there particular things that are really core? Like this curriculum wouldn't work if I didn't have these three aspects. But hey, this part is nice to have, but if we can't do it, that's okay. So that's another interesting spin on curricular design. Maybe you offer particular pieces as an add-on or as an optional, and you see if that makes a difference or not. And then the last thing I want to talk about, which is also in intervention design, is fidelity, right? So if you're doing a one-off, like I'm just delivering this curriculum once and I'm measuring it, it doesn't matter much. But if you're going to be offering it over and over, how do you know you're doing it the same way? Are you recording it and somebody's checking it? Is it the same person that's doing it each time? So they're more likely to do that way. So you want to think about fidelity as a rigor, and that might explain some of the why not. Let's say you handed your slides over to somebody else someday and they, didn't deliver it the same way. Could you actually measure that, capture that as a why not, and study it? Okay, so this, I mentioned that POCUS article that we looked at before, and you can see that what made this interesting again was their subgroup analysis, really getting at, the dose response. You had to attend at least 2, and that this component worked and this component didn't. So that's, although this study was probably a little small, only 29 participants, I'm wondering in terms of the review, maybe this is what boosts them in to be able to get published, because they had some, something that went just beyond, oh yeah, this curriculum worked. Okay, so I'm stopping there.